Hi, I'm Joan Shepherd, and I'm one of the nurse practitioners here at the Coleman Institute. We often get asked about what people should be eating when they're going through an opiate detox. And although people really have bigger fish to fry than what their diet is going to be, I get asked that question frequently enough that I just wanted to briefly address it. The gastrointestinal system is particularly sensitive to opiates because there are so many opiate receptors in the lining along the whole gut. So when people use pain medication or heroin or methadone, Suboxone, those kinds of things, they do tend to get constipated. So it kind of makes sense that if a person is going through a detox, they might experience some gastrointestinal distress, some stomach cramping, nausea, vomiting, diarrhea. So during this early acute part of the detox, when people are going to be experiencing probably the most GI side effects, and I'll just say here that when people are patients here going through a detox, we give them plenty of medication to help alleviate those and many other symptoms that come from withdrawal. But it's probably a good idea for the support person to go ahead and stock up on clear liquids. Clear liquids are things basically that don't have added milk or cream to it. So that could be water, drinks that have electrolytes in it, apple juice, broth, jello, popsicles. And those are the kind of things that are great in the early first part of the detox. A lot of people don't have any more extended kind of gastrointestinal issues afterwards. But some people do have a little bit more of a protracted gastrointestinal issues, and with stomach cramping, maybe some loose stools, diarrhea. And then it's a really great idea to follow the old-fashioned Brat diet. That's Brat, B-R-A-T, and that stands for bananas, rice, white rice, applesauce, and toast, white bread. And these are kind of low residue, bland foods that just have kind of a calming effect on the gut. Foods that have a lot more oils in them or anything with caffeine tend to increase the peristalsis, the action of the GI tract. So sticking to the clear liquids and then moving toward the bananas, rice, applesauce, toast, kind of as an example, is a good idea. After a person completes a detox, they've made this huge decision that they're going to do something so good for them in their life. So it really does make sense in the long run to ultimately focus on a healthy diet. And there's not really time to talk about that now, but in general, people want to be able to get at least 25 to 30 grams of protein in their diet, minimize highly processed foods that add in extra sugar, fat, and salt. It's super important to get a lot of fiber in your diet so you can have a very healthy microbiome. A lot of the neurotransmitters that affect our mental health are actually produced in the microbiome. Also, do a little searching and check out different herbs that have anti-inflammatory effects. Turmeric, ginger, rosemary, just to name a few, are some of the herbs that can be added to your diet to help minimize inflammation and contribute to overall health. Amino acids are another type of supplementation I've seen people use when they are going through a detox or after they've completed a detox. There's not a lot of evidence-based research supporting the use of amino acids, but I do use a handout from time to time from Julia Ross, who's the author of The Food Mood Cure, and she talks about using certain specific amino acid supplements such as GABA, phenylalanine, L-glutamine, and tyrosine, just to name a few. So that's something that you could also find a reputable website and look into that. It's just so helpful to question the thought that you're giving something up when you choose to stop using an addictive substance, and instead get super curious about all the small forward-moving changes that you can make every moment, which in essence are casting a vote for the kind of person you want to be. Thanks.